Good afternoon and welcome. This is a very special opportunity to have Melissa Boteach of the National Women's Law Center. So we are really just interested and excited to dive into conversation. For those of you who I haven't had a chance to meet, my name is Michelle Legaspi Sanchez. I'm the Executive Director of the Fund for Women and Girls. And again, we're just pleased to welcome you here today. As folks are getting settled in, I just wanted to share a few housekeeping notes. All attendees are muted, but we definitely encourage you to interact and engage in different ways. Of course, there's the chat, there's social media. Again, this is just a chance for an intimate conversation. So we do want to allow for as much interaction and engagement as possible. You're also welcome to add the name of your organization and the company when you list your name, just so we know who is here and who is present. Again, just another opportunity to connect with others. And of course, if you want to drop it, your LinkedIn profile to the chat, another way to connect. So we encourage all of these things. And again, just are excited to welcome you here. And thanks so much just for taking the time to join us. I think this will be a fantastic discussion and a great use of our time together. So as you are supporters and partners of the fund's work, you know that this is a big year for us. This is actually our 25th anniversary, and we are really thrilled to be celebrating in a variety of ways this year, which can include both friends from near and far, through our annual luncheon on May 7th, which will be at the Desmond in Malvern, but also in the virtual format. And so again, we're just proud to be able to bring you this special engagement for our virtual ticket holders, our sponsors, and special guests, because I know that you are really invested in learning more about how COVID-19 has not only affected community health, but of course the economic viability, particularly of women and girls. COVID has brought to light the inequities that we at the fund have been fighting for the last 25 years. If you know us, you know our Blueprint Report, which is our groundbreaking study with Westchester University that looks at how women and girls are faring at the local, state, and national levels. So we knew that even before COVID hit, we knew that the wage gap here in Chester County is wider than it is at the state and national levels. And we knew that more than 40% of single moms here in Chester County are living below the poverty line. So COVID has only made economic advancement even more difficult for women and their families to achieve. For example, with millions more jobs lost by women than men, our current downturn has been labeled a she-cession. Not that long ago, employers cut 140,000 jobs in the month of December, and women accounted for all of those job losses. And sectors dominated by women, particularly women of color, like retail, education, healthcare, hospitality, they've been harder hit, leaving even more women and their families to face food and housing insecurity. It's not a pretty picture. And as we are focused on moving towards recovery and building back post-pandemic and post-significant racial trauma, we are fortunate to have partners at the national level like Melissa and the whole crew at the National Women's Law Center who are at the forefront for pushing for systems level change and keeping us all informed at the 30,000-foot level view. The National Women's Law Center is an organization of advocates, experts, and lawyers who fight for gender justice. And Melissa is the VP for income security and childcare and early learning. And I know that they have been a go-to source of information and data for us as we think about the issues that are affecting Chester County and again across the country. So again, we're just thrilled to have Melissa here to share how COVID-19 has impacted women's economic advancement, policy responses that are happening just from chatting with Melissa minutes before we started here. There's things happening to the day today, and to the moment really. And so we're just thrilled to have an expert giving us that on the ground information. And of course, a discussion on what we can all do to support and be part of change and be part of efforts moving forward. So I'm going to pass the floor to Melissa now for her to share some news and reflections, and then we will open the floor to questions and dialogue. So Melissa.
Wonderful. Thank you so much for having me. I have a couple of sort of slides just to sort of show visually. Oh, wait, disabled participant screen sharing. Okay. Well, that's okay. I can do it without the slides. So I will talk you through a little bit, a few key points that I wanted to make sure everybody was aware of to level set and ground our conversation. There is an enormous childcare crisis going on right now, as I'm sure many of you are aware. And so I want to talk to you a little bit about what that looked like before COVID-19, what the COVID-19 crisis has meant for women's labor force participation, for women's unemployment, for childcare, and then finally, what are some of the solutions on the table now, and how do we lean into this moment when there is a much deeper understanding of the caregiving crisis in order to make longstanding change? So with that in mind, I am going to share with you all. Let me see if I can pull up the slides. All right, so I'm going to walk you through some of the top line data about where we are, because as Michelle so aptly put, it's not pretty. So women's labor force participation rate was 57% last month compared to 59.2% back in February 2020. For context, that's the lowest women's labor force participation rate since 1988, since the Reagan administration. And just prior to the pandemic, we'd been celebrating this historic moment where, for only the second time in history in the United States, women comprised more than half of the workforce. And when COVID came, it showed how precarious all of that really was, because we did not have the care infrastructure. We didn't have the public policies in place to actually be supporting women in the workforce. This has not been race neutral. Over the course of 2020, nearly 2.1 million women were pushed out of the labor force, but that disproportionately included Black women and Latinas, 564,000 Black women and 317,000 Latinas. At the same time as women have been hit in terms of getting pushed out of the labor force, they've also been a larger share of folks who are dealing with unemployment, because, as Michelle noted, the She session, the way the pandemic hit retail, restaurants, hospitality, all these female-dominated sectors has left women really bearing the brunt of the unemployment crisis. And importantly, now that we're over a year into the pandemic, it's important to note that it's not just unemployment, it's long-term unemployment. So among adult women ages 20 and over who were unemployed last month, over 40% have been out of work for 6 months or longer. That has implications not just for women's economic security today, but it makes it harder for them to re-enter the labor force. 6 months is sort of this number that many of us who work on unemployment policy and labor market policy know that that becomes a scarring effect in terms of people's ability to get back to work long term. So we have this crisis, and wait one second, here we go. And speaking about it to folks, one of the key factors, I think, has been the absolute collapse of our care infrastructure. And I want to speak specifically about childcare today on that front. So a little bit of background: 1 in 6 childcare jobs has been lost since the beginning of the pandemic. And of those not working, women who are of child-rearing age are almost 3 times as likely as men not to be working due to childcare demands. And according to a recent poll that came out, women are twice as likely as men to say that they left work for caregiving responsibilities due to childcare provider or school closures. On the other end of the childcare crisis, besides the parents and the caregivers, is the childcare workforce, which is over 90% women and disproportionately women of color. You can see in this graph here how overly represented not just women are, but in particular Black women, Latinas, immigrant women in the childcare workforce. This is a workforce that has kept us afloat during this pandemic and before. There is no economic recovery without childcare because parents can't get back to work without childcare. And yet these women have gone into debt. They've put their lives and health on the lines in order to care for essential workers, in order to help families keep their jobs. And so a big part of what the past several months has looked like for those of us who are involved in childcare policy is documenting the state of the childcare crisis, but at the same time, fighting for at least $50 billion of relief to save the sector. Part of the reason the sector collapsed so quickly when COVID hit was that it was already operating on razor thin margins. Providers are earning poverty wages, and that's for doing work that, again, holds up our entire economy. Parents are paying more than they can afford and oftentimes making impossible choices about whether or not they should this month pay the childcare bill or the rent, or whether they should just drop out of the labor force altogether because childcare is eating up such a large share of their paycheck. And so it's been unaffordable for parents. It's been unaffordable for providers. And that system, once you entered COVID-19, meant that there were fewer parents enrolling their kids because of the stay-at-home orders, at the same time as the costs were going up for providers in terms of PPE, in terms of providing safe ratios from provider to children. And all of that meant that we immediately saw centers closing across the board. So this has had a pretty large impact, not just on the childcare industry and not just on parents, but on the economy overall. One of the things that we always say is there's no recovery from the she-cession without investments in caregiving. The risk of mothers leaving the labor force or reducing work hours to assume caretaking responsibilities could end up amounting to $64.5 billion in lost wages and economic activity. And again, we've done some recent research that I'll share with you at the National Women's Law Center that shows that this doesn't just affect women's wages and economic security today, but those wage losses then compound over the course of their lifetimes and end up impoverishing women into their retirements. One of the things we found in a recent paper that we put out with Columbia University is that you actually see, when you track women's poverty rates over the lifetime, as well as men's, you see two major points of divergence. One is in women's childbearing years, when our lack of care infrastructure is leaving people without the means they need to be able to maintain their jobs, when they have higher expenses, when they don't have paid leave, they don't have the ability to balance breadwinning and caregiving, and when there's discrimination against mothers in the labor market. They close a little bit again, and then they widen again in retirement, when all of those compounding factors over the lifetime translate into lower Social Security payments, less private savings for retirement, and women living longer and having more complex health issues. So you see a widening again at that senior time. And our point in this paper is that you can trace a lot of that back to our lack of affordable and high quality childcare when women are in their prime working years. Fortunately, and sorry for this dense slide, it's not all bad news. The news that there's a cost to inaction, I've just gone through, but there's also a huge benefit to investment and to acting. And so we worked with Columbia University at National Women's Law Center to model, if we expanded high quality, affordable childcare to everybody who needs it, what would that actually mean for women? What would it mean for their lifetime earnings? What would it mean for the earnings gap? What would it mean for their retirement security? And we found that if we were to expand high quality, affordable childcare to everyone who needs it, we would increase the number of women with young children working full-time, full year by about 17%. And for women who don't have a college degree, it'd be even larger, 31%. Additionally, Black and Latina women would experience the larger percent increase in their incomes. Excuse me. Something called the unconditional earnings ratio is what we use instead of the gender pay gap when we're talking about childcare, and I'll explain why. The gender pay gap compares full-time year-round workers, men and women, or white men and Black women, et cetera, but it uses the same apples to apples comparison of full-time year-round work. The unconditional earnings ratio is more appropriate for childcare because part of the challenge is that women can't even get to full-time year-round work without childcare in many cases. And so what this indicator looks at is wages overall, not just for full-time, full year. And one of the things that we found is that for women and men ages 25 to 64, with children under age 13, we'd have a 9-cent closing of the gender earnings gap. That's about 12 years of progress. So that's a huge impact on closing a lot of the gap that's due to caregiving responsibilities. Importantly, over the course of your lifetime, access to affordable care could increase the lifetime earnings for a woman with 2 children by $94,000, translating into $20,000 more in private savings and $10,000 more in Social Security benefits. So for a cohort of women today having children, that would translate into $130 billion over their lifetime that they'd be earning more in their economy. And then finally, at the age of retirement, you would see that same woman with 2 children have $160 per month more in increased additional cash flow from private savings and Social Security benefits. It would be a big deal, in particular for Black and Latino women, it would help close some of that racial and gender wealth gaps in retirement if we had affordable, high quality childcare for all. And I do have state by state numbers for all of these, as well as breakdowns by race and ethnicity and educational attainment, if anyone is interested in following up. So this is just a sort of a visual of how you can see women post-reform increasing their labor force participation. So let's get a little bit more to the actual solutions. Like, where are we in this conversation right now? Because we've spoken about the problems that existed in childcare before COVID. We've spoken about how COVID decimated the system, but there's actually a moment, there's also an opportunity that we have right now, because over the past year, more and more people began to understand there wasn't some personal failing they had where they just couldn't figure out their care arrangements, because we've internalized childcare and caregiving in general as these very personal issues that everybody has to navigate and figure out on their own. And there's a lot of shame and stigma associated with when why can't I get this right? Or why is this so hard? And I think that the pandemic, at the same time, everybody was dealing with the same challenges around caregiving. And everybody was also seeing the heroic efforts of our caregivers who were on the front lines of this. And we had almost this like awakening of people understanding what low-income women, what Black women, what Latina women have understood for a long time, which is that caregiving is infrastructure, that it is a hard job. It is a valuable job. It deserves to be compensated, that parents can't work without childcare and that they need to be able to afford it. In short, that childcare is a public good. And so for K through 12 public education, we would never say to everybody, just go figure this out, find an education for your kid, and it'll all be fine. It doesn't matter if the teachers make poverty wages. Well, if children's brains are most rapidly advancing between the ages of birth and 5, and we're sort of leaving parents to this wild west of trying to navigate without sufficient childcare options that are unaffordable to them while treating the workforce as though their work is invaluable, that is not how you treat a public good. And so we have this moment right now where there's this recognition and this national reckoning around how our care infrastructure is insufficient, not just during a pandemic, but it was never okay before. And so this is an opportunity to lean into that and to make some of the big, bold, and most historic investments we've ever seen in childcare. So we've already had a huge victory. We spent the better part of the last year advocating for and winning $50 billion in relief for the childcare sector. 39 billion in the American Rescue Plan, and then 10 billion 13.5 billion in the year prior. And so this is a big deal. We're now working with state governments and administrators across the country, as well as advocates and grassroots, to help make sure this money is equitably and effectively implemented. It is the largest investment in childcare since World War II. And states are all of a sudden dealing with this large sum of money coming their way that they have to figure out how to implement with a very threadbare staff and old technology systems and all these different kinds of things. And so a big part of our work at National Women's Law Center is working with these state administrators, working with the stakeholders on the ground to provide technical assistance, to provide, help them document where they're having successes and challenges, to both communicate the value of the money, as well as some of the ways in which they need more guidance from HHS or additional help in the uses. But we also know that getting the 50 billion was to get us back to an equitable status quo, was to stabilize the industry. What we actually really need to do is to have an equitable economic recovery plan that has the following principles, which are ensuring that every low and middle income family has access to affordable, high quality childcare options. I'll talk a little bit about some of the legislation around what that looks like. We need to be treating caregivers and early childhood educators with respect and dignity, which means paying them living wages and benefits and ensuring parity with elementary school teachers. We need to be providing equitable access to preschool in a model that is inclusive of centers, schools, and community-based organizations, Head Start, Early Head Start, and family childcare centers. And we need to be supporting safe, energy efficient, and developmentally appropriate childcare facilities. So this is the actual physical infrastructure of childcare, especially in childcare deserts. So before I go to the resources, I want to talk to you about what I was telling Michelle right before we went into this session, why this morning has in its own right been such a intense and wild time. We have a flurry of interest right now in childcare from lawmakers across the political spectrum, but and also across committees of jurisdiction. And so today, Senator Elizabeth Warren introduced her bill, the Universal Childcare and Early Learning Act, which would really essentially it meets all of these principles. Last week, Senator Patty Murray and Representative Bobby Scott, who chair the Health and Education and Labor Committees, those are the sort of big childcare committees, in the House and Senate introduced their bill, the Childcare for Working Families Act. We've endorsed both bills as meeting these principles as being a giant leap forward towards high quality, affordable childcare for all. And then also this morning, Representative Neal, who is the chairman of the Ways and Means Committee in the House, introduced a working document or a draft of some large investments he would like to make in childcare. And there was a hearing in the Help Committee featuring advocates as well as working moms and providers speaking about the importance of investing in childcare right now. So childcare is having this moment, and it hasn't had a moment like this in a really long time. And out of this crisis is emerging an opportunity to shape the future childcare policies in ways that are more equitable, that treat the workforce with dignity and respect, and that make it fully available for all families who need it in a culturally responsive and appropriate way. And so we are asking for, because none of these bills is actually going to pass this year. Like that, these are bills that are sort of marker bills to sort of lay out the vision. But the game in town this year is the infrastructure package, and sort of treating caregiving as infrastructure as a way to underscore the importance of it undergirding our entire economy. And so to that end, we are joining with coalition partners and leading a charge to ask for $700 billion over 10 years for childcare. And that is a ask that makes room for any of these bills, but sort of lays out the vision for if we want to get to this place where we're meeting these principles of creating these jobs and making sure it's affordable for parents and making sure providers are earning fair wages, that's the sum of money we realistically need. And tomorrow we're expecting President Biden to give a speech outlining his vision, which will have the largest number a president has ever recommended on childcare and early learning. He'll be recommending $225 billion for childcare and $200 billion for universal preschool. There's obviously a gap between that and the $700 billion that we're championing, but we're making clear that this is historic. We've never had a president call for $425 billion before in childcare and early learning policy. And we want to thank them, and we want to underscore that this is a commitment to showing how central caregiving is to his economic recovery plans. And we're going to work with Congress to try to secure the amount that we need to do the whole kit and caboodle, which is the $700 billion. And so this is a big week on this policy, and anything you all want to do to engage, to weigh in, and to lean into this moment, we'd love to partner with you.
That's great, Melissa. I wanted to I definitely have some thoughts from what you had said, but I will just go straight to the chat where a question had popped up regarding what you were just last speaking about. There's been a lot of stated opposition in the Senate against the ARP. Has the NWLC seen consensus in the Senate to support this funding?
No. And I think that is, this has been unfortunately passed on partisan lines. They had to use the budget reconciliation process, which means that, you have to hold every Democrat plus VP Harris breaking the tie vote. And I don't think childcare was the reason that they didn't secure bipartisan support. Traditionally, childcare has attracted more bipartisan support. And in fact, this past summer, we worked in the House to have a bipartisan vote on $50 billion in childcare relief, which included many conservative Republicans recognizing that we can't reopen our economy without childcare. I think that part of where we are running into some disagreement is on the overall theory around the American Rescue Plan, as well as in the recovery packages that are being proposed. But I want to be clear, we have not seen bipartisan consensus on this.
Thank you. I mean, it seems like just a lot of what you're saying and implying is that this is very much a long game, right? Like we're in historic moments at right now, but I think it'll take some time to really see big policy shifts. It wouldn't happen, like you said, this year or anytime in the short term. So sometimes I think it's hard to know how we can really take advantage of the momentum and do something now. So what are some suggestions you might put out there regarding just action items that we can take, even if it's part of in the short term, to really work towards those longer gains?
Well, let me be clear now that this is actually a huge opportunity for action. It's just not on these particular bills. These bills are designed to sort of lay out the policy vision for where we want to go, but we don't get anywhere without the money. Because in childcare, you can't and you don't want to do it on the cheap. You can't make it more affordable, and you can't pay the providers without hundreds of billions of dollars invested in the system. Right now, for example, only 1 in 7 eligible children is getting any kind of childcare subsidy. So the opportunity that we have this year and at this moment is to participate in the conversation around the infrastructure package, and ask for $700 billion over 10 years for childcare. And so in working with your representatives and your senators to really underscore your support of that is a huge thing that you can do right now, whether that's in letters to the editor, whether that's in op-eds, whether that's in calling your members of Congress. That is sort of the big ask right now. And then after that, whatever amount of money makes it into the budget for childcare, that's when they then have to write the legislation. And so that's sort of stage 2. And after at that point, there's going to be sort of provisions that we really like from all of these different bills that we're going to be advocating for and urging members of Congress to write into the law. I don't want to, that doesn't mean the end of the work, to be clear. Even if we win, I don't think that $700 billion is probably the end number, because they end up negotiating and things like that. But let's say, I'm just going to give as an example, we get $500 billion. We then have to equitably implement that money. We have to defend that money from attacks. And we have to make sure that we are flagging the places where there are still holes so that we can get the rest of the system that we need. And so that's, I think, where the long game is. And so part of what we're doing at National Women's Law Center is working with both national, state, and local partners, parents and providers, and a whole range of stakeholders to build out a movement network where we are regularly sort of consulting on research, on grassroots outreach, on communications and narrative, to sort of build the movement that we need to win right now, to defend and implement that win, and then to really finish the job and get high quality, affordable childcare for all in the next 10 years.
Thank you. Yes. And to kind of put into context to how the fund has been active in that, you mentioned just coalitions, both at the state and the national level. And we're part of the Paid Leave for All coalition across the state of Pennsylvania, which has joined the #CareCantWait campaign to, again, support these efforts for the upcoming relief bill. And just they've done a lot with the others, with the packages that had been passed already. And one thing that I know that has emerged is not just childcare as priority in terms of care and care's infrastructure, but paid leave and advocating for paid leave specifically. So can you touch on that a little bit?
Sure. So NWOC is very active in the Care Can't Wait Coalition, which is a table of national groups that are all working together and with local and state partners in order to say, we're not going to be pitted against each other. It's not that if we win paid leave and then don't win childcare, or we win home and community-based supports to care for our loved ones with disabilities or who are aging and aging in place. Like women need all of these things, family need all of these things, and they're part of a larger care infrastructure that we're fighting for. And so we've been very active in supporting the actions of Paid Leave for All, Moms Rising, and others. They've been active in turn in supporting our actions on childcare. And we're working together to really build the narrative about how all of these things interconnect with each other. They're not just sort of 3 separate policies we're throwing together at a coalition table. They're part of a lifetime arc of care that everybody needs.
Sorry, some technical difficulties on on our end here in the office. But thank you for that. One thing that, as you spoke earlier, that really just resounded with me and had me excited was just the data that you were sharing in terms of the ROI, right? The benefits to investing in childcare, and how that not only is impacting families and women in a positive way, but our economy, right? Like these larger community economic benefits. And so, to me, that's something we really share through our blueprint report. Like, we have the local data about, how much it really takes to be able to, just for a woman to work here in Chester County. We know that even for a two-parent household, uh, it's over 20% of the household income is going to provide just for childcare, right? So that's just the cost of working, which is incredible. And so that data is really important to us, and we know that it can definitely just be very impactful in being able to show that economic impact. And it's something that we're always kind of bringing out to the community. But as you're doing this on a more national scale, I'm curious about, how do we spread that gospel? How do we, as and I'm sure the folks that are on this call, you're preaching to the choir, people who understand that investment is super important. So how do we really make inroads with our local business community about why this investment is going to pay off, not just for women and their families, but just, the community as a whole? What have you found to be effective as a way to communicate that with people who traditionally wouldn't understand the positive, bigger economic impact in the community?
Yeah, I mean, I think that again, the pandemic the silver lining has been that a lot of businesses understand that the reason that their female employees are either leaving or getting pushed out or whatever it is because they haven't been able to navigate the care options or the lack thereof. I mean, in September of last year, 4 times as many women left the labor market as men in 1 month, coinciding with the return to distance learning. And so they're seeing in real time how this is affecting the employees in their offices and in turn their bottom line as a company. And so I think there are real opportunities to speak to them in those terms. The one thing I will say about engaging with the business community is that one of the places we really need them to be vocal is on building high quality, affordable childcare system. And so, like, for example, a tax credit for employers to offer childcare to their own workforce is unlikely to be taken up by a low wage employer. Maybe it would help a law firm or something like that. But for the women who we center in our work, who are in the low paid labor market, et cetera, their employers are not typically trying to do things to retain them or to really make sure that their work life is super easy. And so it could be quite inequitable to do it that way. What we actually really need is a system like that laid out in the Childcare for Working Families Act or the Universal Child Care and Early Learning Act that is, again, investing at the same time in paying the providers and building the supply as it is in making it affordable for parents. And that is where we really need business voices to be loud and clear that system benefits them. Because if everybody's advocating for a tax credit for their own for their own business or whatever it is, we're not going to get to the system that we need to support the women who we center.
I 100% agree. I mean, just over the past year or so, we were involved with advocacy at the county level, where the county was trying to figure out the investment that they were going to make in childcare. And this is the information, this is the data, these are the points we were making to them about just how much of a crisis it was before COVID, and now more than ever we really need them to step up. So we were fortunate that our county alone invested 15 million in childcare subsidies, as well as grants to childcare providers to be able to build their infrastructure and just be able to support the needs. So we were, again, just bringing that message to the community, and again, just it's exciting to see how you're doing this at the more national level. The one thing I also wanted to ask about was just if you could go into a little bit more detail regarding you talked about long-term unemployment and how that just has such big implications. And I've certainly read that, when you're talking about those big implications, we're seeing that generations after generations, right? Like it's just, will have a ripple effect. Can you speak a little bit more on that particular piece?
Sure. So, I mean, there is, once you've been out of work for 6 months or longer, on the macro scale, not talking about like one individual, every individual has their own unique circumstances, but looking at the data as a whole, you see employers are more reticent to hire employees that have a longer gap in their work history. There's discrimination that takes place against long-term unemployed workers. Never mind the fact that over time it might affect your credit score, or it might affect the stability of your housing situation or other kinds of things that, being employed provides with that income that then in turn affects your the ability to find and keep a job. So you start to enter into this sort of vicious cycle of making it harder to find a job, which makes it harder to afford the things that you need to find and keep a job, et cetera. And so it's not that there's anything magic about 6 months and 1 day versus 5 months and 29 days, but that's a general period at which people sort of come to the end of like their ability to sort of make their way through with the resources that they have with unemployment insurance, if they are lucky enough to get it. And at which point we start to see an uptick in employer discrimination. And so that then has long-term scarring effects on people's ability, because now we're prolonging a tough spell in somebody's life in ways that affects them, their children, their mental health, a whole range of things.
It's heartbreaking. It really is heartbreaking. A portion of the participants today represent community-based organizations or nonprofits, a lot of those that we fund. And so, I always look to them to really be able to understand and get a pulse of what's going on the front line in terms of, the work in their community. And so I know that they have a lot of stories to share, which I know can also be a very powerful tool in advocacy and in just building momentum. Maybe if you could share some thoughts or ideas or just what you have seen to be effective in terms of the use of stories in the advocacy work. I think that would be really helpful to those in our audience who represent those organizations.
Yeah, I mean, there's an expression that nobody ever marched on Washington because of a pie chart. The data is really important, and it's important to contextualize and make the case, but it's the stories and the experiences on the ground that build movements, and that move lawmakers and help them understand and contextualize what this challenge looks like for a single mom of two who's working 2 shifts, or for the childcare provider whose business had to shut down and now can't get the access the relief dollars to reopen, or whatever it is. Like, that's where the rubber hits the road in terms of lawmakers understanding. I would say that at National Women's Law Center, we do a lot of work with supporting storytellers. We do a lot of work with Moms Rising, who collects a lot of stories. But we also think of it not just as, here's the person's story as a commodity to prove X, Y, or Z point, but in thinking about, who is this person? What interest do they have in becoming a leader? How can we invest in their leadership? How can we center not just their story, but them personally as the spokesperson? And so in really thinking through, how do we take this person, if they're interested on this journey, not just from sharing what happened to them, but all the way up into testifying before Congress or speaking to reporters or whatever it is, so that because they are an expert in their own life. And so really trying to do some of that deeper, authentic storytelling, not at the scale of thousands of stories, but really focusing in on leadership development alongside of it. I hope that was helpful.
Yes, I love that. I love that idea of just what you said about it not being a commodity, but really working to empower these women to tell their own story and use their lived experience to change, their situation. I think that's really powerful. Well, I want to be respectful of your time, since I know it's a busy day, but there is one question that popped up in the chat that is more personal that I think would be a great way to kind of end our conversation. And that's what influenced you to get involved in this work, and what continues to drive you to fight for women and girls?
Yeah. So I will say that, I've been a social justice junkie since I was a kid. I had a very deep sense of fairness and what was not fair. And my mom was very active in community causes, just like all of you. And so I watched her, and that was modeled for me. My faith, I was very involved in, Jewish youth groups and Jewish social action from a young age. And that informed sort of my first job, which was doing interfaith organizing work on economic justice issues. But I would say a sort of watershed moment for me also in moving from sort of thinking about international development, which is where I originally had been focused, to really focusing on domestic policy and women and girls and racial and gender justice, was I was doing my master's degree in Ireland, and it was my second day over there. I just arrived and I was settling into my apartment, and Hurricane Katrina hit. and I was watching the news and watching, the way in which gender and race and economics just had this very toxic confluence in who was left stranded on the roof, and who was able to leave the city, and whose homes were in a place where they were completely and utterly destroyed versus whose homes were structurally sound and in safer places. And it was just such a visual, it just spoke to me in a different way. It's almost like I had this moment where I was like, this is what I want to do. Not necessarily specific to Hurricane Katrina, though I did some work on Hurricane Katrina. But I'm really thinking about how the sort of racist and sexist roots in so many of our systems and policies are what lead to such disparate outcomes. And then how do we not just fix those policies, but really get at the process of how we fix them. And so I ended up switching my master's work to focus on women in social movements who are navigating intersectional identities, who are trying to balance being in a women's movement with white women who didn't always understand the racial justice implications, and being in a racial justice movement with men who sometimes were not understanding the gender implications, and interviewing them and doing ethnographic research and trying to really think about how you build the kinds of movements that are longstanding and that can affect the social change we're seeking.
That's amazing. I love that. You gave me goosebumps. Well, I want to just pause a second in case there's any other thoughts or questions, but I feel like this has been a rich dialogue. I have certainly learned a lot, and I'm grateful for your time and your energy, your unbounding energy. I know you're balancing it in terms of being a working mom. And so, I feel your pain and really just appreciate all the commitment and the drive that you have. And that's from one social justice junkie to another. I feel you on that. So thank you, Melissa, so much for your time, and I wish you the best in your work forward. And if there's anything that the Fund for Women and Girls can do to continue to support the National Women's Law Center, please do not hesitate to reach out.
Back at you.
Thank you. And once again, thank you so much for making the time to join us over your lunch break. We look forward to seeing you at the luncheon, and if not the luncheon, just some of our other upcoming events this year in celebration of our 25th. So thank you again, and enjoy the rest of your day.